Older women, what have you noticed about young women that has you concerned? Watching women in their early 20s get filler slash Botox slash etc. and wind up looking older than me, 10 plus years older, is wild. This race against aging has always been around, OFC, but it's getting way out of hand. It saddens me how afraid of aging young women are these days. Yes, my friend's daughter just turned 30 and she's been getting Botox, fillers, and blimp lips since her 20s. She looks very odd suddenly, and not in any good way. This stunned me, as she was beautiful before any of that. 30 is still so young. 40 is young. Why do we do this? Insecurity. There's profit in telling people they're not enough as they are. All these girls should watch the substance. It literally cured my body dysmorphia. Oh, my Botox appointment got canceled, and I've never gone back. And if you try to pull an intervention, she'll probably say you're all shaming her very sad. Yep, they'll tell you you're jealous. But the thing is, at 45, having never done any of this stuff to my face, I feel like I look younger than the 33-year-olds who have been doing this stuff to their face for at least 5 years. I'm not jealous of you at all. You actually look older than I look. I read somewhere that a lot of the fillers migrate or swell BC, they draw in water, and that people will suddenly look strange due to the puffiness of the filler. Kind of bizarre. Fillers are made largely with hyaluronic acid. Hyaluronic acid is a humectant that is produced by the body, and its main job is to attract and retain water. Once you inject it into the skin, you cannot control how much water that hyaluronic acid attracts. So, you get movement, and the filler itself expands because that's its whole shtick. If you dissolve it, the hyaluronic acid is dissolved, sure, but the skin around it expanded to accommodate for the HA. So, you get laxity in the skin that's going to be difficult to correct. I tell my patients to stay away from filler and to look into biostimulators instead, where moisturizer and HA serum. Yep, fillers don't break down and disappear like they're touted to. They just migrate, and you end up with what is known as pillow face, or when you only get lip filler, it migrated to the parallel area, and it gives that constant duck lips look. Fillers need to be dissolved at some point. The timing is different for everyone, but they need to be broken down and then redone if the person wants. I watched a news documentary on filler migration, and it migrates much farther than anyone anticipated. In the documentary, doctors perform scans, I think ultrasound, but I don't remember, and you could see where the filler went. There were patients who thought the filler was all gone, but most of it had just migrated far from the original intended location. I'm 30 and just started getting Botox for migraines performed by my neurologist, and a number of people who say, well, your forehead looks great, when I tell them, annoys me. I know they mean no harm, but it's annoying because it's not a cosmetic procedure. I had to trial medications for a year to get my insurance to cover it. I get 35 injections across my head every 90 days. It hurts. I would much rather people ask how it's working or if I'm happy with it as a treatment option than say, oh, lucky you. You get Botox for free. It's not even free. It's partially covered by insurance. People's obsession with their appearance at my age is wacky. I would absolutely never get Botox for cosmetic reasons. It's painful. Ugh, I'm with you. I get it in the front and back of my neck / upper back and along the back of my scalp every 3 to 4 months for cervical dystonia. When I was in the literal throes of my first flare-up in chronic pain with my head literally stuck turned 90 degrees to the right, all people would say when I said I was starting Botox treatment was either, can I have some, or, well, at least your neck won't get